Can you hear me okay?
Yes, go ahead.
Perfect. So good morning again. Happy New Year. I'm Dr. Johnson. I'm a business owner of 20 years with K&K Services, and we provide multilingual and multicultural rehab services for our pediatric populations with special health care needs. And we just had the opportunity to charter a nonprofit to help support those services, as well as some subsidiary services which deal with integrative nutrition and lifestyle medicine for our families who are caring for those types of children with special health care needs.
Okay, perfect. So what compelled you to launch the field of speech and language? Everybody has a different niche that they want to be able to get into in order to, because everybody has different needs. And so when we see a need, we feel that that's something that we want to do or share to help someone else. So what compelled you to pursue that field?
Absolutely. That's a great question. So in high school, I loved languages, and I loved biology and chemistry, and I felt that was something I could funnel into a career. And after much prayer and just spending time with friends and family, including my now sister-in-law, we took a class together in the field, and I fell in love with it and decided to do a bilingual track and become a fully licensed professional, now providing services in several states online. So it's been a joy to work with, to get up, basically get up every day and get paid to make life better for children.
Okay, perfect. We're going to switch gears a little bit, so in regards to speech, because I wanted to hit on this topic a little bit when it comes to autism, which is a rising factor. And so some of the statistics state, and this is coming from the Autism Society factual sheet online, it says, which causes children or adults to receive speech and language. According to the Autism Society, more than 3.5 million Americans live with an autism spectrum disorder. Now, from where the neck of the woods of where I came from years ago, that was not actually heard of. And so I wanted to see if you could be able to elaborate on that just a little bit for the audience as to why do you feel that number is continue to increase?
Exactly. I have the same concern, and you are right. The statistics are there, and the incidence has increased, and as well as the prevalence of autism in just the U.S., it's increased by 119.4% from 2000. From 1 in 150 in 2010 to 1 in 68, according to the Centers for Disease Control. It is considered the fastest growing developmental disability. And I'm going to be honest with you, when I first started my practice, we were dealing more with Down syndrome or cerebral palsy. And now we're finding more and more children, male and female, are being diagnosed with autism. And that is why we as my business partners, we've created a curriculum with a local community college to help these students get through high school and prepare for college. Because once you're diagnosed with it, it is a lifelong disability, and you're going to need lifelong support.
Okay, because now in our location or demographic, we're in the state of Tennessee, and so some of the children here, when it comes to certain deficiencies as far as language barriers or what have you, they have a struggle in the school systems of finding specific speech therapists to be able to come in and work with the autistic children. So take, for instance, to give a perfect example, one of our grandchildren attends school, and he's about 5, and so but he's in the classroom with the children that are Down syndrome, in the same classroom with the children that perhaps cannot talk and what have you, or in the same classroom with the children that have other disability needs. So what do you think that you could share to the listeners of how we could be able to bridge the gap where the school systems are able to implement more and more speech therapists or individuals such as yourself inside of the district, so children can get that specific nurturing that they need?
That is a great point, and I cannot stress enough the need for families to be adequately informed of their child's needs if they have a concern and or the teacher has a concern, because our children spend the bulk of their development in schooling, that they collaborate through the school system by way of the special education system. Yes, most of our school districts have classes that kind of group a constellation of different disorders and disabilities in the same classroom, such as autism, cerebral palsy, intellectual disability. But where the rubber meets the road and where these children get differential diagnosis and intervention is when the family sits down with the school personnel and they have that individual education plan developed, and they say, hey, I'm concerned about my child's behavior. I don't want my child being bullied, or I don't want my child hitting and being seen as being aggressive. We need a behavioral intervention plan. The other thing with recruitment and retention of speech-language pathologists in the schools is making sure that they're collaborating with any outside clinic or home health services that this child may be getting. They may be getting applied behavioral analysis therapy, some sort of behavioral intervention, and that is really what drives communication. If you cannot communicate verbally, you're going to communicate physically. So collaboration and continuity of care is key to making that child's life better and less stressful for the child as well as the family.
I guess it does. It's kind of adequate because I guess you do have to perhaps maybe, apply yourself to the school as well. That's a very, very good tool, and I think a lot of parents is not aware of that. I think sometimes we may just settle, I guess, for mediocre where we are, and perhaps we may not know that we can be able to go out and voice our opinions in the school system to see what the school can be able to do to be able to have more tools and resources for children that have specific language issues. Great. I didn't even, that's something to think about. So explain some of the procedures which you use for those you assist with speech and language.
So our field is a bit of a misnomer. It is speech-language pathology, and it falls under the umbrella of physical medicine and rehabilitation. Depending on what setting you work in, you're going to use different procedures. I work in acute care. I work in a trauma level 1 hospital. So I may use a standardized test to diagnose a traumatic brain injured patient, but if I'm in the clinic supervising my preceptors and my assistants, I may just use a preschool language scale, which is a parent questionnaire as well as a play-based way to find out if a child has listening comprehension problems or oral language problems, if the child is having swallowing issues because they were born too early, or they had a stroke while they were being born, or they have a heart transplant, then my job is to actually go in and physically palpate their muscles of their face, their neck, and look at how well their tummy is tolerating a bottle feed, if they can even bottle feed or breastfeed. So there's a plethora of different procedures that we use, but specifically for autism, in the schools, we work very closely with the educational diagnostician as well as the licensed specialist and school psychologist to diagnose a child with where they are on the spectrum of autism. And there are some professionals such as myself, and one of the clinics that I help do supervision for, Obla Therapy, we are a licensed autism center through the International Board of Credentialing and Continuing Education. So not only are our families getting the speech and language services at our clinic, but they're also getting the autism support that they need. So it really kind of depends on what the child's diagnosis is and, of course, what the parents' concerns are.
Oh, wow. Okay, great. So in regards to the success rates, what are the success rates through your strategies of training?
Well, that is a very good question. It's a bit of a loaded question because in the acute care setting, when I am consulted to go up to neurology floor or intensive care floor, my job is to assess whether or not they can be rehabilitated. And sometimes that is a plus, and they are, and they may need more intensive rehabilitation, and sometimes it's a minus, and I have to be honest with the family and the other providers, and we have a care conference, and we say, you know, we're really concerned about this child and whether or not they'll be able to make it, you know, make it out of the hospital. But usually when I see a patient, if you get to me in acute care, that means you are rehabilitation ready. As far as outpatient and clinic are concerned, our success rate, I think, has become much better. And I don't mean to be general or vague, but every disability has kind of a different prognosis. If it's a chronic health condition such as cerebral palsy, Down syndrome, autism, these kiddos, they usually live very well if they have the right support and early intervention. They're usually able to get out into the community and get a job that is appropriate for their developmental level and make a life for themselves. And so it really boils down to a lot of early intervention, parent education, and continuity of care across the lifespan to make sure that these children are successful.
Perfect. Because, you know, I was looking at a statistic online with the state of Mississippi, and this doesn't have anything to do, I don't think, with speech, but it has to do with in regards to children. And I think the rate was like up 700. I think they hit like 750-something reports of child abuse in that area. So that also made me think about the parent in regards to learning, skills, preparation, different little things like that. And so that's the reason why I brought you onto the show, to be able to give facts and tips and resources to a lot of parents, because a lot of times I had a autism conference back here probably about 5 years ago, and so with that, the parents, they were struggling with the children because they did not know how to address this issue on their child. Sometimes the parent will just, react to the child in a combative type of way because they're not accustomed to dealing with that type of behavior. So that's the reason why I wanted to bring that to the forefront on the broadcast in 2019, to be able to give some relief to parents and to the listeners so they can be able to utilize the tools and resources that you provide on the show. So are there future...
Could I just interject very quickly on that? You mentioned foster care children, adopt children who are put up for adoption. And again, working for a trauma level 1 center, I see patients that are not just in the hospital because of a car accident or an AT vehicle issue. It's because of some sort of abuse, and that then places that child potentially in the foster care system. And whether it's a kinship placement or a new family for this child, we do have to educate and inform our families on how to work with these children that have a communication or even a swallowing difficulty. And so my business, K&K Services and Oblitherapy, and my research assistant, Nicole Carter, that was the foundation for which we started our nonprofit, Dr. Love's Healthcare. And anyone in the world can get on my website and they can pull any resource that deals with rehabilitation of speech and language and communication. A lot of the data obviously is local and specific to Texas, but there are some international resources on there so that families, when they walk out of my hospital, they may never see me again, but they always have that on the World Wide Web to access. Because the system, Child Protective Services, they have their own set of resources that I was able to get my own training in when I was in graduate school. But as far as working with special needs children, the parents have to do a lot of fishing unless they have an online resource such as Dr. Love's Healthcare. So you're absolutely right.
Oh, wow, that's perfect, because it appears that you go in just a little bit deeper with your own nonprofit to be able to reach out to the children and the community even further. Is that correct?
That is correct. So we have an office that we just opened off of Marvin D. Love, which is in the south side of Dallas, and it's predominantly Hispanic and African American, and working for one of the largest nonprofit private hospitals in Texas. We do get a multitude of and a variety of patients locally and across the world, but we also provide online therapy. So it doesn't matter where you are. If you're in Cambodia or you're right here in Texas and you're not able to transport your child to our office, we'd be happy to talk with you, teleconference with you, or do a HIPAA-compliant Zoom-based app where you can see me and I can see you, and we can talk through things and make the appropriate referrals so that it's easy for you to access the services that you need as a family.
Well, that is awesome. The listeners, the community, the children or the parents can be able to access the resources and tools online as well. That is awesome. That is awesome, because autism is something that individuals rarely discuss. It's not actually brought to the front. To the front, and so that is awesome. Hopefully that the listeners and future listeners to this podcast will be able to grasp that information and be able to run with it. At least I hope so. Are there any future breakthroughs to combat speech delinquency that you think?
I think so. I'm a former accreditation board member for our profession, and what I have found over the past 5 years serving on that board is our field has made great gains in working in other partner fields to assess and treat pediatric populations with special health care needs, particularly autism, because it is a growing concern. And some of those, they span over neurology, over physical therapy and occupational therapy, such as myofascial release, doing more integrative nutrition, dietary things that will help children with autism, not necessarily a pill, but having the family really look at their child's behavior and what they're putting into their systems, and really trying to be holistic about addressing not just the language and communication aspect, but also the behavioral aspect. So I think our field has done a very good job of trying to become not just a silo of specialties, but more cross-disciplinary and collaborating with other fields such as ENT as well as nutrition to make sure that these children have a better life.
Okay. So in a little bit more in-depth, I guess, question in regards to, we're going to go back to school in regards to the educators versus the education. What type of challenge do you feel that it may be for the teacher to be able to provide education? Because a lot of times now here in our location, it's different, I guess, in each demographic area. In this demographic area, if a child comes in and they have some speech issues, delays, delinquencies, or anything like that, and sometimes the educator will advise the parent to get on medication. I mean, that is an option, but I'm thinking sometimes that may be a struggle for the education faculty as well, is dealing with autism, students with autism, and students with speech delinquencies.
I agree with you 100%, and I wish we had a little blue pill everyone could take that had behavioral issues, whether it was autism or, or ADHD or ADD. And unfortunately, it does not work that way. The body is multi-systemic. It has a lot of different things that work together to function. And so I think the challenge, to answer your question directly, for the teachers is time. They don't have the time they need to really spend one-on-one, even in the special education system and some of the top autism programs we have, including one we have here in Plano ISD that I had the opportunity to serve as a graduate student. If we had the personnel that we really needed to work with these children one-on-one and then help them socialize in group settings, that would help. The other thing is, our school districts receive federal funds, and so any family can ask for an evaluation. Well, in the school system, they have a timeline, and it's 30 days to get consent and test, 30 days to do the actual meeting and implement the changes in the classroom setting. And I'm using those numbers loosely because it changes. It's not it's not a blanket timeline for all school districts, but that's the general timeline versus a medical model where if you're taking your child into a clinic or a home health setting, someone's coming to your home to evaluate your child, such as early childhood intervention, you have a much smaller window, a 48-hour window to be contacted, and more or less, within 2 weeks to 45 days, you're being seen. And so I think time is the factor, because the earlier you intervene, the better. And some of these children, unfortunately, are diagnosed late, and it happens. And so you have to troubleshoot, and you have to figure out with the family what is going to be the best route at that point.
I do agree. It's just a challenge. I would say on both sides. I guess it would be the educator, as well as the parent, as well as the student as well. But with the right resources, and also the parent reaching out to be able to voice that can also be able to be a plus on their side as well. So how rewarding has this opportunity, that the field that you're working in, the nonprofit that you have started, how you're effective in the community, how you're effective in the state in which you do, how rewarding has this been for your career?
It's exciting. I'm going to be honest with you. I am a workaholic. Most people who know me, I really do try to live up to my name, Dr. Love. Every day it's something I'm very passionate about and compassionate. And whether I'm working with a child at a clinic while I'm supervising an assistant, or I'm doing an international presentation for the International Association of Logopediatrics and Phoniatrics, it's an honor and a privilege to serve, because my motto is serve with excellence, make an impact, and leave a legacy. And so having been in the field for 20 years, it's been very rewarding, and I see how I'm transitioning from being a practitioner to being more of a mentor in the field, and being able to leave a legacy for other therapists to follow, a template through webinars, and just being able to talk with you online and have some voice so others can know it can be done and to not be discouraged.
Perfect. So what are some of the future studies that you are working on? Are there any future studies that you're working on with your nonprofit to be able to, I guess, expand what you're doing in the community?
Yes, ma'am. So this year I'm working on a couple of projects, not just community speaking engagements, which is rather new to me. I've done a lot of international traveling and national traveling to help kind of get the word out at the level of the provider, but now I'm trying to be more community-based, and so I have my PR specialist. She handles all of my social media pages, and in concert with Therapy, we have a Facebook group where our families are able to get up-to-date information on children with autism or any other disability. They can look on my social media outlets, Dr. Love's Healthcare, Dr. Katandria Johnson, K&K Services, on any Instagram, Facebook, Twitter, and they can find the latest research on what's going on. A lot of families, they'll get online and they'll research, but they don't necessarily know how to apply it. And so it's helpful if you have someone in the field who can kind of break down that information and make it palpable to apply to their specific situation. The final thing that we're doing, my PR specialist and I are being very aggressive about, is developing webinars for providers. So the first one we're looking at is motivational interviewing in physical medicine and rehabilitation. So it kind of goes back to what I was saying, the interprofessional counseling approach, and really working with our families and finding out what their needs are and what the barriers and facilitators are to making sure they are adherent and compliant to the plan of care for their child. And so motivational interviewing is basically a counseling technique. It's very effective in chronic disease management. The second topic we're expanding on is the autism curriculum that I started with Tarrant County College. They already have a curriculum in place for children, college-bound students with autism. And this year we're going to be launching a nonverbal autism program tentatively for the summer. And just recently in talks with Northern Speech Services, which is a continuing education provider, on just kind of regrouping on culturally and linguistically diverse differential assessment and treatment, and our service delivery model for children who have special needs, who have autism. How do you work with a family from Colombia, and they don't know the language necessarily, they don't know what services are available. How do they know if their child really has a language disorder versus a language difference, because they're emerging in their language, their proficiency of English?
Okay. We got a couple more questions that we're going to have for the show, but we're going to take a quick break, and we will be back with Dr. Katandria Johnson. We'll be back in a moment.
From those of you saving for retirement in New York, to those refining your retirement strategy in California, and everywhere in between, Fidelity can help guide you. Whether you're here on land or out there at sea, seizing the day, or up till the wee hours of the night, we work to help you bridge the gap between your working reality and your retirement dreams. Fidelity Investments.
Start the morning pampering yourself with a moisturizing Tibetan mud body mask, aromatherapy essential oils, and a hydrotherapy see-through bubbly tank type thingy. Yeah, like you've got time for all that in the morning. Squeeze a little spa into your shower instead with Dove Body Wash.
And we're back on the show, and this is your show host, Diane Winbush, and we're talking with Dr. Katandria Johnson. And so we got a couple of more inquiries that we have, and she's been sharing with the audience in regards to autism, the factors of it, tips and tools and resources for parents, her own personal nonprofit organization that she has with her team that she has created for the community. That way parents, students, educators, and people alike can be able to get these resources that she has through this organization, as well as through the research studies that she does as well with her own profession. So, Dr. Johnson, in the next chapter, where do you see yourself as a specialist in this area?
Thanks, Diane. Well, again, as I stated earlier, I've been privileged and honored to participate in not just clinical research, but field research and developing assessment tools for our field, and serving on the accreditation side. I see myself doing more public service, informing the community of their resources that are available to them, whether it's through the federal funding that the schools have been provided, or their insurance, making sure that they know their rights. As if they have a child with autism, for example, their ability to pull their child out of school and go get clinical therapy if that's the only time that they can get therapy and it still be, they're not considered absent for that day. And also just serving on boards and being more of a resource to providers and educating them on other avenues and tools that they can use to help children with special health care needs, whether they're traditional, conventional interventions or alternative interventions such as integrative nutrition or essential oils, and really making things practical for families so that they know what their options are and what is best for them.
Okay, perfect. So are there any tools or resources that you would like to share with our listeners in order for them to be able to get more in-depth resources, such as any books, any links that you would like to share, even your own website link that you have as an option for them so they can be able to go there and be able to find more resources?
Absolutely. Thank you, Diane. So the first resource, it is a link that I would recommend for any family interested in accessing services for their child, is the American Speech Language Hearing Association.
Go ahead.
And also the International Board of Credentialing and Education Standards for Certified Autism Specialists, speech pathologists. Okay. And then finally, you can access drlovehealthcare.org for resources on gaining local services as well as international services. And drkatjohnson.com is my business webpage that can provide you additional resources.
Perfect. We are so thankful that you took the opportunity to be on the show today in order to share these tools and resources, as well as to bring the listeners into your nonprofit studies that you're doing for I would like to say the nation, actually, because when we're on the website, we have access to a bigger or broader audience. Again, this is Diane Winbush, and you have been speaking with me today